Yes, over to you, ma'am. Dr. Rajni, you can start your this presentation.
Okay, thank you, Dr. Gunjan.
Is
So,
there
good
some
afternoon.
sound issues? Sorry
Hmm?
to interrupt, ma'am. Is everyone can hear us? Everything is audible?
For me, I can hear,
Okay.
but sound is a little bit
Maybe.
not so loud.
I just read a message. Dr. Hina is some issues with. Yes, so Dr. Kirti can hear as well. I guess we can start then. Okay. So ma'am can join again. Ma'am, you can start. No issues.
So, am I audible? Yeah.
Yes, definitely.
Okay. So, thank you, Dr. Gunjan. So, I'll be, good afternoon, everyone who are present here. So, today I'll be talking about part three of reproductive health, which is on contraception awareness and pre-conceptual counseling. So, in the picture, we can see that there are many methods of contraception. So I won't be going on detail on that. We'll talk about Nepal's perspective. So family planning program in Nepal. How to close this? Okay, okay. I'm sorry. Family planning program in Nepal. Planning is one of the major priority of government of Nepal through Ministry of Health. Uh, and Nepal is experiencing a large growth in population. There's a rapid growth in population. So every year we have annual increase in 2.2% per annum. At present, our population is 30.55 million. And in Nepal, this family planning information and service are being provided through government, through social marketing, non-government organization, and private sectors. So female community health workers play a very important role to provide information and education to community people. So these are implemented by they are chosen by the government, and they help in distributing condom and risk supply of oral contraceptive pills. In government health system, currently short-acting reversible contraceptive methods like male condom, oral pills, and injectables are provided on a regular basis sorry, through primary health sector centers and health posts and primary health care outreach clinic. Long-acting reversible contraception like IUCD and implants are available only in the limited number of hospitals like health posts and primary health centers, where trained healthcare providers are provided. Sorry. I can move on to next slide. So family planning program provides the following services. It gives free counseling and family planning commodities, permanent family planning methods, like vasectomy for male and mini lab for female are also provided. These are provided by the government through health camps. Long-acting reversible contraception like ICD, Depo-Provera, and other contraception pills and condoms are also provided by the government. These services are available all public institutes. So we have 77 districts in Nepal. So every district is presumed to have one district hospitals, which is 77. There are primary health centers, which is number 51, and health posts, about thousands, more than thousands, and female community health workers who conduct community-based family program, like I've said earlier, through family health division of government. So governments of Nepal target on the Sustainable Development Goal. They include specific target for use of modern methods of contraception by women after reproductive age that is from 15 to 49. The targets are to be 50% used, 50%, 53% by 2022 and 60% by 2030. And On this survey, government survey, 57% of the currently married women were using method of contraception, and 43 were using modern method, while 15 were using traditional method. Out of modern methods of contraception, sterilization was more common, which was 13%, and injectable, followed by injectable contraception and implants. In traditional method, withdrawal was far the most common used. And among them, 13% of the currently married women choose this method compared to 2% of other rhythmic methods of contraception. So friends, use of family planning method, currently married women are rising from 29% to 57% in 2022. So over the same period, the use of modern contraception also increased from 26% to 44% in 2006. But since then, the percent is similar, so it has not risen far. It's similar to 43% in 2022. So this is a picture from taken from our government survey. So it's the same thing, just in figure. In 43% were currently using modern contraception, while 15 were using traditional methods. So our main target of promoting family planning are to, of course, prevent unwanted pregnancy and unsafe abortion. So it's a data that around 73% million induced abortion take place worldwide each year. And out of six out of 10, all are unintended pregnancies, and 3 out of 10 are end up in induced abortion. So out of this induced abortion, 45% of abortion are all unsafe, and 97% takes place in the developing country like ours. And we know that unsafe abortion is leading, but it's preventable because of maternal mortality. That's why government is spending lots of money on this. Each year, 4.7 to 13 million maternal deaths can be attributed to unsafe abortion. So in a developed country, it is estimated that 30 women die every in 100,000 unsafe abortion, while in developing countries, the number rises to 220 deaths due to unsafe abortion. So there, many studies have done in Nepal. These are few I've taken. The study was on awareness and practice of contraception in women who are attending OPD. It was in gynae OPD in one of the medical colleges in Nepal. So this study showed that only 65% had ever used contraception, and the prevalence was 33%. The best known they were aware of contraception was Depo-Provera, followed by contraceptive pills and condoms. Among permanent family planning, female sterilization was mostly known to them. They were aware, 81%, and male sterilization was 77%. So knowledge about contraception was quite low, 12%. A knowledge about emergency contraception was quite low as it was newly introduced, in our country. Regarding current use of injection, Depo-Provera was the most widely used contraception. So they had knowledge, but the use was only 11%. Likewise, there was another study which also showed that there was the great discrepancy between knowledge and use of contraception. So they knew about contraception, but the use was only 21%. So there was another study to find out the use of emergency contraception. So it's not newly, but recently introduced. So there's a new wave in the rise of using this contraception. The studies have found that only this were used. Female knew about emergency contraception, but they are most used by youngsters among young women who are 25 years old or less, and they were used by educated women. So they knew about emergency contraception, and these are used by the college students. So that's all I have to say about contraception awareness. So moving on to next preconceptional care topic. So preconceptive care is a complete set of preventive, promotive, and curative health intervention administered to women before the pregnancy to have a healthy mother and a newborn. Globally, every 2 minutes, a woman dies of pregnancy-related complication causes. Most of these are preventable. It's from the WHO report 2020. And out of this, 95% of all maternal deaths occur in low and low middle income countries. So we know that preconception care has a positive impact on a range of outcomes, including reduction of mortality and improvement in health outcomes for mother, offering long-term benefits for the woman, improved health outcomes for the neonatal child, which will lead to health benefits in later life as adolescents and adults, and of course, reduction in incidence of too early to quicken pregnancies. So, gapping with the good knowledge, we advise women to have a gapping between pregnancy and abortion and prevent in the nutrition status of mother and
Yeah.
woman. So these are some facts about Nepal. In Nepal, out of total 12
ಊಟ ಮಾಡಿದ್ದಾನೆ ಮಾಡಿದ್ಯಾ? Sorry, I didn't know you were eating that.
12,976 deaths among women of reproductive age in 2021. 653 were pregnancy related and 622 were confirmed maternal deaths. So some reports show that 50% of all maternal deaths in Nepal were due to induced abortion. So abortion was legalized only in September 2002. Unsafe, unhygienic, and sometimes fatal natural practices induced by traditional birth attendants are the reason for maternal deaths. And there was demographic health survey done in 2006 revealed that 82% of all women gave birth at home, and a skilled professional attended only 18% of the birth. So this also led to more maternal mortality. It is improving since 2022, with only 79% of live birth delivered to health facilities, Nepal, and still 19 at home. And government has endorsed and program like Safe Mother Program, AMA program, which has focused on reducing maternal mortality rates. The maternal mortality rate has decreased, and at recent 2021 report, it's decreased to 151 per 100,000 live births of Nepal, and infant and neonatal mortality has also decreased to 21, 28 and 21. So this is and move on. So there are several preconceptional model care which has been implemented and developed by American College Academic of Pediatrics and American College of Obstetrician and Gynecologists. They have classified the main four components into four categories. So initially physical assessments, which includes family history, taking family history, behavioral history, and obstetrics history, general physical examination, vaccination, uh, vaccination including rubella, varicella, and hepatitis B, risk screening for HIV, STD, and genetic disorders, and counseling for consumption of on folic acid, cessation of smoking, alcohol, and weight management. So CDC also has the same thing they have categorized, and main goal of CDC clinically content of preconception care with three main goals for preconception care. So they have divided into providing protection, avoiding harmful exposure, and managing. So providing protection means promoting normal weight and nutrition management, including folic acids, proper pregnancy planning, promote spacing between pregnancy. So avoiding harmful exposure like tobacco, drugs. So these are similar things, similar to American guidelines. Preconception healthcare reduces risks. Many adverse neonatal outcomes, like we know, birth defects, Good counseling can prevent preterm birth, low birth weight, small and large gestational age, neonatal mortality, and HIV infection. So preconceptive guide for prevention of birth defects includes healthy weight. It's a similar things. Infectious disease. We'll come to this later. So the research have shown that periconception consumption of 400 grams of folic acid will relatively reduce the reduction of anencephaly by 72%, heart defects by 28%. There were meta-analysis which showed decrease in cleft palate by 30%, small positional age by 25%. So this all with prescription of periconception with 400 micrograms of folic acid at least 4 weeks prior to pregnancy and continue to 2 months in the period of pregnancy can decrease decrease this birth defects. So healthcare providers will encourage women to achieve a healthy weight also to prior to pregnancy. We know that obesity is a modifiable risk factor and often associated with other conditions like diabetes. Various studies have shown increasing prevalence of diabetes in Nepal. There was systemic review and meta-analysis. The study was there were 9 studies with 20,865 participants conducted in 1 year from 2000 to 2021, which showed a pool prevalence of 2.2% of gestational diabetes. And while reading through this journal, I also found that the prevalence of diabetes was high in India and Bangladesh, like 10%. It was 10%. So counseling women with diabetes about the importance of having tight glycemic control prior to and throughout pregnancy is very essential. The glycemic control in a normal population and pregnancy is different. It's a strict in pregnancy. It's a strict glycemic control. Women with gestational diabetes, I had increased of later developing diabetes also. So with gestational diabetes, people 5% of after 5 years, women can develop gestational diabetes. Screen all women. So one should screen all women for gestational diabetes during pregnancy. So usually it's done at 24-week pregnant with a 50 gram of glucose GCT. So women with diabetes can have a high risk of having large babies and birth defect as compared to women without diabetes. So healthcare provider also should focus on counseling about screening for infectious disease before pregnancy like syphilis and HIV, malaria, tuberculosis, hepatitis B, C, and herpes. We know that maternal syphilis can pass through the placenta causing congenital syphilis. So in pregnancy, women are tested for syphilis through VDRL. And women are also screened for HIV during pregnancy, but one should be counseling before pregnancy. We know that adverse outcome of the baby are prematurity, low birth weight, infection of the baby. Women should be counseled about vaccination status and vaccinated if not. The rubella during pregnancy can lead to spontaneous abortion, stillbirth, and congenital rubella syndrome. But government has already implemented this vaccine in expanded EPI schedule. So since 1977, women and all individuals are getting rubella vaccines. So worldwide, it is estimated that 100,000 infants are born with congenital rubella each year in non-pandemic years. Yet, it may be that due to underreporting, the true incidence cannot be, maybe more. So varicella during pregnancy can also lead to fetal death and varicella embryopathy. So these are the immunization schedule in Nepal, and I think it's similar in Southeast Asia also. This rubella and rubella are implemented in the API schedule, but HPV virus infection is not implemented. Only in 2 districts, the government has enrolled this vaccination, and later in future, government is planning to implement. We as healthcare workers will also provide counseling about tobacco, as it has harmful effects on pregnancy. Smoking intervention, cesarean intervention should be administered prior to conception. Smoking we know that smoking increases the risk of congenital disorder like limb deficiencies, official cleft, orophacial clefts, and gastric cases. It is estimated that a third of the world's population aged 15 years or older smoke, including 12% of the women. The proportion of women who smoke in high-income countries is estimated to be 24% compared to low-income, 7%. But smoking by women is increasing in lower-income country by about 3.4 per annum. So globally, each year, approximately 12 million women smoke during pregnancy. I couldn't find much data about Nepal, but there was one study which showed that smoking during pregnancy was done in elderly uneducated people. So elderly means not youngster was not as they were educated and aware of the adverse effect. So women who were from village and who were age 35 and more, 30 plus, they were uh, they found to be consume smoke, as they were not aware of the adverse effect on the pregnancy. Healthcare providers should also counsel about women about harmful effect of alcohol during pregnancy. Alcohol consumption increases risks of spontaneous abortion, fatal deaths. It can cause a range of conditions which persist through the child's life. Includes fetal alcohol syndrome, which involves characteristic craniofacial abnormalities, prenatal and postnatal growth deficiencies, and central nervous system dysfunction, and fetal alcohol spectrum disorder. So this will lead to physical, mental, and behavioral learning disability later in life. So before getting pregnant, women should be counseled about stopping the teratogenic drugs. These are isotretinoin. Some examples are warfarin, AC inhibitor. So non-teratogenic drugs should be avoided wherever possible. But many women may need to take medication during pregnancy to manage their health condition like epilepsy. But in some cases, avoiding or stopping drugs may be more harmful to the woman. So changing the drugs is essential. So it is important that the women start or stop medication use. Women need to speak to the providers, the healthcare providers, about the use of the medication.
Coming is it?
So other healthcare should also counsel women during pregnancy about family planning. So there should be about spacing between pregnancy, which will help in mother's health and birth outcomes. And conception, perinatal care, important for women to receive regular medical care before and during pregnancy, and which allows screening and detection of risk factor and monitoring existing conditions. Genetic counseling is a concern. So genetic counseling informs people about their genetic risks. In Nepal, in district hospital, in district area, in remote area, in Mongolian community, they have a trend of marrying. They marry their own relatives, like father, sisters, children. So consanguinity is one of the problem. So one should counsel about that also, about the risks of consanguinity. Healthcare provider, we should counsel not only to the women, but we should target men also about preconceptional health. We should include men and women because they make a plan together. Men and women help each other practice a healthy lifestyle. So they can also prevent, if they are counseled, they can prevent their partners from sexually transmitted diseases and protect themselves. And we know that so the men who smoke expose their partners to secondhand smoke. So if we counsel men, we can reduce the risk of smoking hazard. And father's health and nutrition impact baby's health also indirectly. So, so I just wanted to show this plan, policies of policy and program of safe motherhood and newborn health. Health. Actually, our main target is to make even family planning precaution counseling to make to have a safe baby and mother. So safe motherhood this program has implemented since many before 1994, and women are encouraged to deliver. And since 2017 plans, women are encouraged to deliver at institution, hospitals. Safe delivery incentive program includes giving money to the women also. So if they come to hospital and delivery at hospital, they will get some incentive. Like it's minimal, but they will still get incentive. And in 2009, AMA program was implemented, which mandates women to have a 4 ANC visit. And during the ANC visit, they get incentive also, and they get incentive for the transport also. So the government has made a focus on this safe motherhood program. So with this program, mortality rate has also decreased from 2096 in 2022-23. We can see so mortality has decreased from 539 to 116 now. At present, it's 115. The target is to decrease 70 deaths per 100,000 women in 2030. So there was study, this was done on knowledge and practice of pre-consumer care in Nepal. There were few. So in the survey, it was found that only 47% had a good knowledge of pre-consumer care, and more than nearly 45% had never practiced pre-conceived care. So this patient are unaware of pre-conceived counseling, pre-conceived care. So another study also, it was done in Kathmandu community, in capital. So when the women were surveyed, 200 women were surveyed. In this study, 66% had the knowledge about pre-conceived care, and only 4%. Only 98. But they were because it's capital. They were aware and utilized the precautionary care. So educated people. This study showed that average level of knowledge about precautionary care was only 2%, and high. Sorry, I can see. So 2% had a high level of utilized. So they knew, but the only 2% ever utilized the income and utilized the care. So thank you. I'm done with the presentation. So these are some reference. This was the reference I've taken from WHO and Nepal's survey data. Thank you, everyone.
Thank you very much. It was an amazing talk and very comprehensive, and you covered the ground very well. Sorry, there was a bit of a hassle in the morning about the traveling issues, but we managed to continue with the presentation. So well done for that. And I can see you've put in a lot of effort. The poster has been liked by a lot of people, so I don't know whose idea was it, but it was really very nice and simple. So good work.
It was my sole effort for presentation also.
All right, so that was your idea. Yeah,
Yeah.
great, wonderful. So yeah, so finally, and yeah, and I hope, are you coming to the conference?
No, unfortunately, no. I will have loved to.
All right, okay, right, no worries. Okay, are there any questions from the presenter at all, from the participants? There's nothing in the chat box either. Right, if there are no questions, then we must thank the presenter and the Team Nepal for arranging it, and Jyotika for the support. And thank you very much, everybody. See you next time on the World's Doctor Day, and probably get to meet some of you in the conference as well.
Thank you, Hina.
And thank you, ma'am. Yes.
Though it was a little bit disturbing during the presentation, so lot of
Yeah, it's okay. It's how you carry on and persevere. Obstacles do come. It's how you take the task to completion. That's the art of doing it, and that's leadership. And I must say, you have demonstrated it on several occasions. And hats off to you, to your hard work. And yeah, so that's well done. And thank you, Dr. Gunjan, for sending us the reminders as well.
Yes, welcome, ma'am.
Yeah.
Thank you for joining us, and very wise words. Dr. Rajni, your presentation was very well compiled. Apart from contraception, the challenges of preconceptional counseling have been very well put up. So thank you for taking out time. All those who could attend it, it was a great opportunity, and I guess this recording will be very useful for others who could later on watch it.
Yes, sure. And I'll probably ask Dr. Rajani to do it on another forum as well. We need to bring the low middle income countries' perspective on family planning to the global audience, the wider audience as well. So probably I'll ask you to do this presentation on another forum too. Okay, thank you.
That would be great.
Thank you.
So,
Bye.
yes, yeah, bye-bye everyone. I'll be stopping this now.
Thank you. Bye.
Thank you, Gunjan.